One of the things that's unusual about the side effects of dabrafenib is it causes fevers. It causes pyrexia, and you have to interrupt the doses sometimes up to a third of the times for development of fevers. And these are not just tiny fevers. These people can get rigors and chills. And it's important in managing the patients that they know how to get in touch with a physician that deals with this commonly, because they will show up in emergency rooms and have high fevers and they think they're infected. And the thing you end up doing is first interrupt the dabrafenib or the other BRAF inhibitors, encorafenib and vemurafenib, and allow the fever to subside. If it is persistent after more than 1 or 2 days, you'll commonly want to give doses of steroids to help control the fever. The class of drugs with the MEK inhibitors, which include trametinib and binimetinib and cobimetinib, is that they commonly cause gastrointestinal toxicity. They can cause some nausea, some vomiting, and diarrhea. And so you have to be careful about dose adjusting and being able to effectively manage the patient's diarrhea and with the nausea and vomiting. The other part is if they get single agent BRAF inhibitors, as I mentioned before, the unusual one is they get the skin toxicities. Skin toxicities mean they develop malignant lesions. If they were getting the combinations, it's actually unusual for them to get the skin tumors, but we do monitor their skin while they're getting treated. The side effect profiles have been tested in melanomas. The side effect profiles in lung cancer have yet to be compared. As I mentioned before, the only pair that's been through testing and been reported over the last 5 years is the combination of dabrafenib and trametinib, so it's difficult to compare. When you take a look at it in melanomas, if you compare the 3 regimens, there's not a dramatic difference between the side effects between the pairs. It looks like binimetinib and encorafenib may have fewer GI and fever side effects.